So it allows for a lot more interaction. For example, I've gone to, quite frankly, fairly routine PowerPoint presentations in Second Life, but the fun part is all the discussion that goes on in the back channel and talking with your neighbor about what you're seeing or what you're not seeing, and finding out what your neighbor's experience is with the stuff, again in a way that if it were in real life would be just highly disruptive and rude. So it's as James says, it's an acquired skill, but it's one that makes it a very rich learning environment in that sense.
Hey, can I add something here on that note? It's really interesting when you're in, like I've done a whole bunch
Okay,
of...
well look, what I think we'll do now is, are there any questions for
several of us will
James, Ben or Marty, just in terms of what they've been talking about over the last few minutes?
You know, from the conference, and then you can have a separate conversation using, you know, something like Skype, and do that in the background during the WebEx conference, especially the bigger ones. So you can discuss the material that's being discussed in the conference using a separate platform. It's kind of an interesting concept.
And I wonder about the ability
I think what we'll do now is just for the last few minutes. This is where we lose everybody. I want everybody to essentially go up in the air and fly, and go due north from here. So use the little maps to go due north, and you'll find a large building, which is a replica of the Sacramento main agricultural hall, the exposition hall. I want you all to essentially just dive through the roof of that and end up inside the hall. You'll find that you can actually go through the roof. It's not associated with any sort of blocking physics. And then we'll all meet actually inside the main California agricultural hall, hopefully in about less than 1 minute. So if you all just go up and due north, and then look at the map for where all the dots are, and you'll see the rest of the crew. There's about 19 of us here tonight, so just look for lots and lots of dots and head for that. You can all just dive down through the roof, and then you'll end up on the floor below. The roof won't stop you going in at all. Excellent, you've done very well to get here so quickly. Now we've just got to look at our maps, and you can see where everybody else is. They look like there's a few people spread around the island looking for us.
Hey, babe.
Okay, well you can see that we're all just exercising. Just use the gestures to move around and keep yourself active. And it looks like people are gradually finding us. I'm just going to shoot up through the roof and see if I can bring a few more people in.
Do you want to go outside, babe? Hold on. There you go, love.
Okay, well I think most people are here now. James is just finding a couple of stragglers who are not with us yet. I see some good dancing, that's excellent. So I guess, I presume most of you have been to Cal Expo at some stage. Do you actually recognise the inside of this hall?
No, I would need several cows and probably a couple sheep to recognize it.
Yeah, and the guy who sells the ShamWow and also cleans one of your shoes. But yeah, I recognize it.
Right, so this is the main hall where they have the main sort of agricultural show, and as you say, there's usually lots of animals in here, and you know, various other stalls and things for the main exposition centre. But it's actually set up now for an emergency clinic that the Sacramento County ran about 3 years ago, when they essentially were trying to train their staff to be available in the event of a major anthrax outbreak. And obviously one of the issues with anthrax is that you need to get people onto antibiotics fairly rapidly. And health systems are not good at dealing with screening thousands and thousands of patients, or a whole population essentially, for potential diseases like anthrax. Many of you will remember the letters that were sent and the anthrax scares, and in fact 4 deaths that occurred in New York fairly soon after 9/11. But I guess I'm interested that there were a couple of emergency clinics rapidly set up to hand out antibiotics after those anthrax scares. Does anybody have any idea how many patients per hour were actually able to be passed through the New York clinics? No guesses even? Well, anyway, I'll tell you. Essentially, there were about 200 patients per hour that were got through the clinics that were set up after 9/11. So that's an incredibly small number of people when you consider that we're talking about the whole of New York needing to potentially be screened. And so one of the aims of this exercise here was to see, can we get through a number of thousand people per hour through a very rapid screening process. I see some of you going, that's absolutely fine, anyone who has to go is perfectly okay. So if you just follow me, I'll walk you around very rapidly what the whole process was here, and you'll get an idea of what these clinics were like. So I'm just coming down here to where the general public come in through the main doors. Now you'll see we've got all these funny little blocks and things lying around on here. They're there deliberately as a process that in fact James worked on quite a lot for this, where we were trying to develop, and we did develop, a whole series of pretend patients that could run through here. So one of the nice things that you can do in Second Life is you can essentially create bots, and you can have patients running through continuously. I can promise you, if you try and get the general public to come and spend 6 hours constantly going around essentially a clinical circuit like this clinic, but you don't get too many volunteers. And when Sacramento County did this, they had about 1,000 volunteers turn up after a lot of media publicity, but the reality is most of the volunteers only stayed for about an hour to an hour and a half, and they didn't want to stay for long periods of time. And so one of the beauties of these automated systems is that you can have bots that will just keep on going round and round the circuit and can be used for whoever you're training to practice on, and they never run out of steam. So again, essentially if the patients came and stood in this long area of the hall, they came to a registration desk here. Now this is the first thing that would never have worked, because if you look at it, there's only really places for 4 people to register people, and clearly that's not going to happen very fast. Everybody has to fill in a certain amount of paperwork. They then were meant to come across to a waiting area here and be called in groups of about 10, and if you follow me through here, you'll see they came into this little area here, and they had to be consented to have the antibiotics. So they all came in, and in groups of about 8 or 10 sat and watched a short TV video which told them about anthrax, told them about antibiotics, told them about the risks associated with being treated. So they had the consent video, which is obviously more efficient than just consenting everybody individually. They then had to come out here, sit down again in another waiting area before they actually were screened. And then if you follow me, they all came to these screening desks where essentially a range of nurses were sitting, and they had to fill in rapid screening questionnaires to make sure that they didn't have any other major medical problems that would mean they shouldn't get these particular antibiotics. And of course, if they had behavioural problems or already maybe had anthrax, they had to then be separated out at this stage. And they'd be separated out by either coming over here for a full medical screening with a number of doctors doing extra interviews. If they were behaviourally disturbed, as happens sometimes in these situations, then they would actually be taken out of the building and looked after way behind the group of us way on the other side of the building. And then finally, once they've gone through the screening process, that they've been consented, they come down here and they sit and they wait again in this line here, and they finally get to actually go and see a group of pharmacists who are all sitting waiting at these positions, and the pharmacists give them their medication, and at that stage they literally walk out this door and they're finished.